Have you ever felt that you can suddenly hear your own heartbeat, which is pounding hard and fast? In fact, you can hear it so loud and clear that you almost get conscious that maybe others can hear it too. This is the so not welcome heart palpitations. This is when you can feel your heart racing, skipping beats, being irregular, and it can be a cause of panic. So what causes these heart palpitations? And why has this suddenly started in your later years? 1 in 4 women between the ages of 45 to 65 can experience palpitations. So is it anything to do with your hormones? Is it something that would just disappear by itself? Or is it something way more serious? Watch this video to learn about heart palpitations in detail. Assalamu alaikum sisters, and welcome to my channel. If you are new here, my name is Dr. Nikita Islam. I'm a gynecologist turned perimenopause health coach. I'm also a revered Muslimah and a mother to 3 wonderful children, alhamdulillah. I help Muslim women navigate through perimenopause and menopause with more energy, focus and confidence by following holistic wellness practices that are safe and effective, easy to follow and aligned to our deen. If you are interested in knowing more about perimenopause and menopause, I invite you to attend my free workshop, Hormonal, where I talk extensively about menopause and perimenopause and all the different changes that your body goes through during this phase. One of my clients, Sarah, came to me with 2 main complaints: very heavy periods and palpitations for the past 3 to 4 months. Have you experienced this? You suddenly feel your heart racing, and this can cause a lot of anxiety. And most of the time, you may feel that you have developed some kind of a heart condition. Palpitations feels like your heart is racing, pounding, fluttering, or like you have missed heartbeats. Palpitations can last for seconds, minutes, or even longer. You may feel it in your chest, your neck, or even your throat. Palpitations can happen at any time, even if you're resting or doing normal activities. It may be related to hormonal changes. So just like hot flushes, which gets better with time, so does palpitations if it's simply hormonal. And although it can seem alarming, in most cases, palpitations are actually harmless. I advised my client Sarah to go to her doctors and get herself checked out. Her doctor ran some blood tests, checked her hemoglobin, thyroid function, did an ECG, and alhamdulillah, it came out all clear. After we got the all clear, I advised Sarah some diet and lifestyle measures, and in a few weeks, alhamdulillah, her palpitations were much better, and although she would still have them off and on, it wasn't as frequent. So what are the causes of palpitations? My first advice is do not presume that it is because of hormonal changes. It's always better to be safe rather than sorry. The common causes of palpitations are anemia, an overactive thyroid, even dehydration. It could be because of excessive caffeine intake, strenuous exercise, certain medications, and even generally just stress and anxiety. Sometimes palpitations can be due to an abnormal heart rhythm that may need medication to correct it. Rarely, heart conditions may cause it, and this may need the opinion of a cardiologist. Usually your doctor would check for anemia, thyroid function, and do an ECG to make sure that everything is okay. And if this is all clear, it is possible that you may have palpitations due to hormonal changes. So then, what causes palpitations in perimenopause and menopause? The main cause of palpitations in perimenopause and menopause is decreasing estrogen levels. Estrogen helps in the function of many different parts of the body, including the female genital tract and the breasts, but it also has an effect on the heart, the part of the heart that is responsible to generate the rhythm of the heart. So you can develop something called sinus tachycardia, where the heart rate becomes faster because of less estrogen. Low estrogen can also affect the blood vessels and the nervous system, and this itself can cause palpitations. Now, usually palpitations are associated with a lot of anxiety, and a lot of women who have very severe palpitations, they say that they feel they're about to die or have a heart attack. Have you felt this way? Palpitations can also affect your sleep, and sometimes when you go to bed, you may find that your sleep is very disrupted, and this can cause a lot of anxiety, which again prevents you from sleeping. So let me know, have you experienced any of this? The frequency and intensity of palpitations can vary greatly. So many women can have mild palpitations off and on, and they're not really bothered by it. And for some sisters, it can be very severe and cause a lot of anxiety. So what can we do to reduce palpitations? So you could reduce caffeine, especially late afternoon onwards. Avoid any kind of strenuous exercise. Do more relaxing exercise like Pilates. Keep yourself well hydrated. Practice relaxation techniques like diaphragmatic breathing that reduces anxiety and can reduce palpitations as well. This stimulates the vagus nerve and slows down the heart rate. Watch this video to learn how to perform belly breathing or diaphragmatic breathing. Avoid sugary, salty and spicy food if you find that you get palpitations after eating them. Let me share an interesting fact with you. There's some surprise foods that can cause palpitations. Chocolate contains theobromine that can cause increased heart rate and palpitations. Aged cheese and processed meat contains an amino acid called tyramine that can raise your blood pressure and cause palpitations. Now, don't shoot the messenger. I love chocolate just as much as you do. But if you can correlate an onset of palpitations after you've indulged in your favorite treat, it may be better to avoid it for a while. HRT can sometimes help with palpitations, especially if it is known to be caused because of low estrogen. However, for some sisters, they may notice that palpitations can get worse after they start HRT. Magnesium supplement can be very helpful. So can calming herbs like lemon balm and chamomile. A late night lemon balm brew is a very good idea if you want to reduce palpitations, especially at night. A bonus tip. Keeping a journal of your symptoms will help you notice what might trigger your palpitations. So make sure you note what kind of food and drinks you consume when your heart palpitations start, what you're doing when the palpitations start, and how long do the palpitations last. If you are having frequent palpitations, it's possible that you may be having other symptoms of perimenopause, like weight gain, period problems, hot flushes, etc. If that is so, I have something for you. But before that, share your thoughts in the comments. Don't forget to like, share and subscribe for more discussions on women's health during perimenopause and menopause. If you are experiencing different symptoms of perimenopause, I have created a playlist of the most common symptoms of perimenopause and actionable tips to help with them. Do check them out here. Jazakumullah khairan for watching, and I will see you inshallah in my next video. And remember, your best is yet to come.